For this week's Wellness Wednesday, we're taking a closer look at lung cancer. In 2013, Maimonides Health established its lung cancer screening program. Since then, Maimonides has diagnosed hundreds of cancers, many at early treatable stages. However, experts warn that only a small fraction of eligible New Yorkers are getting screened. For more on this, we're joined by Dr. Jason Shaw, director of the Maimonides Lung Cancer Screening Program. Great to have you with us this afternoon. That's alarming, where people are not going in to get screened. Why do you think that is? They just don't think they're vulnerable to cancer? What's going on?
I think generally there's a lack of awareness that a lung cancer screening can detect cancer at an earlier stage where we know it saves lives.
Yeah.
And so we're working on breaking down those barriers. Sometimes I think there's stigma that people think it's a smoking only for smokers, but we know that it affects a lot of people. And sometimes people think that there's cost associated with screening, and that's not the case. Insurance covers lung cancer screening if you're eligible without any deductibles. So, and the other thing is there are more centers available now than there used to be. Centers like ours in Brooklyn, which serve a diverse community where lung cancer is a real problem. And so we're trying to make sure that people have access to that care.
We are seeing non-smokers now developing lung cancer. That's something that you see more frequently now.
Unfortunately, it is. We've seen up to 20% of women are never smokers who are currently being diagnosed with lung cancer, and we don't understand why. And while it's scary and alarming, I think in the future we may be able to elucidate what those causes are, whether it's environmental or other factors that are at play.
So even if you're not a smoker, get screened. That's obviously part of the message here.
Part of the message is, well, we can't unfortunately screen the never smokers. And a lot of people, I get that question a lot, because it's not common enough in never smokers. However, in the near future, that may be something that we can do. But if you are 50 to 80 years old, if you smoked a pack a day for 20 years, what we call 20-pack year history, and if you're a current or former smoker who've quit within 15 years, you are eligible to get a low-dose CT screening and talk to your doctors, and they hopefully can recommend a place that you can get one of these scans. It's quick, easy, painless, and safe. So.
Yeah, well, talk to me a little bit more about that, the screening process and what's available out there. The technology has changed as well, too. Is it a little bit more advanced now?
It is. The resolution of the scans is better. The amount of radiation is much lower, and it's quicker. So we've also been able to hone in on distinguishing between what's a benign or harmless small nodule and something that may be of concern, precancerous or cancerous. And so the radiologists that interpret these scans are very well trained and have clear-cut guidelines to do so.
So early detection, just like all cancer, is very important, of course.
Yes, early detection is key.
And if you are diagnosed with lung cancer, talk to me about some of the treatments and what's the course of action if you are diagnosed.
So from diagnosis, you'll see a specialist. In my case, I'm a surgeon. I do a lot of minimally invasive surgery. And if you have an early detected, screening detected cancer, for example, or an incidentally detected cancer, you can ultimately, if you're fit for surgery, get a surgical removal of the cancerous portion of the lung, and you can live a strong, long, healthy life and get back to work. For other people where the cancer is at a later stage, it does very often involve some other treatments, but the response rates are great. We have things like immunotherapy, what we call targeted therapy, where the treatment is really tailored to your type of tumor, and people are living longer. I should stress that lung cancer is a disease that people are living with and not necessarily dying from. So right now, lung cancer survival is improving. We still have a ways to go, but that's the message that people should know, that this is similar to other cancers where it's going to be a road bump, and but people get through it. And I counsel my patients all the time that's what we're hoping for.
Dr. Jason Shaw, director of the Maimonides Lung Cancer Screening Program, thanks for the information this afternoon. We do appreciate it.
Thanks so much for having me, and I look forward to being back here anytime.